Supervisor Johnson
has joined the conference.
Good afternoon, ladies and gentlemen. It is October the 26th. This is the special board meeting, regular agenda. We have one item listed. This will be a discussion of possible action, Ray, an update from the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, county responses regarding COVID-19, updates, and taking necessary actions based upon the updates. Madam Clerk, can you verify who we have on the telephone?
Supervisor Angus?
Here.
Supervisor Johnson?
here.
Supervisor Gould?
Here.
County Manager Elters?
Here.
Okay, and we have Supervisor Watson and Chairman Bishop in person.
Okay, thank you very much, and I'll turn the floor over to our Public Health Director, Denise Burley. Good afternoon, Denise.
Good afternoon, Madam Chair, members of the board. I'll start with running through the numbers here. We've had 4,148 cases to date in Mojave County, 219 deaths. We've had 3,750 people recover, approximately 90% of the cases. 96% of the cases have been completed, so that's 3,969. And we have 179 active and or new cases that we're working on, which is about 4%. For the week ending 10/17, we had 92 cases. The week ending 10/24, we have 57 cases so far. And I say so far because that week has not yet closed out, so there could be additional cases added or subtracted throughout the process. And we'll know that maybe in about another week or so. Those numbers will be final. Any questions on the numbers? Supervisor Gould, just so that you're aware, we are working on the suicide rates that you requested at the last meeting, so we hope to have those to you as soon as we can get that information and put it into a format and a report.
Thank you.
Certainly. Reviewing the hospital report that you received this morning. As you may have noticed, the number of ICU beds that are in use by COVID-19 patients, and keeping in mind those are positive confirmed cases and also persons under investigation, patients under investigation. So that's a combination of those two. But those numbers have crept up ever so slightly, and so we're monitoring those very closely, as I'm sure the hospitals are as well. Additionally, I think from what I've seen, just sort of anecdotally and not looking on a graph form, the number of ventilators in use for COVID-19 has also increased slightly. Any questions on the hospital?
I don't think so, Denise.
All right. Moving on, just wanted to give everybody a temp staffing update and where we are with our investigators and temp staff. We currently have one half-time coordinator that's coordinating all of the investigators and some of the office specialist staff. And we have 8 investigators currently. 5 are 1.0, the other 3 are working part-time, 20 to 25 hours per week. One investigator is currently assisting in the warehouse. And then we also have some that are still assisting with schools and the school liaison role. We have a 1.0 data entry clerk, a 0.75 COVID public health nurse, and one 1.0 FTE office specialist, also trained as an investigator. So if we need to scale up, we have some immediate capability there and capacity. Any question on staffing?
No questions.
All right. So since I was unable to give a report last week, on Thursday, I did want to make you aware that the CDC has changed its close contact guidelines. The applicable change is really the fact that it's a 15-minute cumulative over a 24-hour period rather than it being 15 minutes altogether in one lump sum. So someone who is within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period, starting from 2 days before illness onset, or for asymptomatic patients 2 days prior to test specimen collection until the time the patient is isolated. So a rather complex statement, but basically just consider that if you're around somebody for a cumulative amount of time of 15 minutes within a 24-hour period, that will count now as a close contact per the CDC's guidance. Any questions? Okay. Also, for the business benchmarks, we're still in the moderate range, and we'll continue to monitor that, so we'll follow under those moderate requirements for the businesses that are affected by the executive order. Okay. I just wanted to take a few minutes, if you would indulge me, to talk a little bit about the masks. I know this has been a very hot topic in our community, but in many others as well. The recommendations and requirements to wear masks have been met with a mix of acceptance and skepticism and concern. There have also been concerns that mask requirements infringe on constitutional rights. While I'm not a legal expert and won't speak to constitutional rights and how a mask will or will not or can or cannot fit into that legal requirement, I can speak to the growing body of evidence that demonstrates that while not in and of itself a perfect solution, mask use reduces the spread of COVID-19 virus. The effects are amplified when used in combination with physical distancing, staying home when you are sick, washing your hands, avoid touching your eyes, nose, and mouth with unwashed hands, and cleaning and disinfecting frequently touched objects and surfaces. So as a addition to that, I just want to make it clear that the CDC does not recommend masks for children younger than 2 years old and anyone that has trouble breathing. For those, there are some possible alternate measures that they can take. One would be a face shield instead of a face mask, which gives a better airflow. Doesn't offer the same level of protection, but it is a barrier that can be used. I also recognize that there have been other jurisdictions that have used the age of 6 as a measure for their proclamations related to wearing a mask. While none of those are currently in play, we currently work off of, and always have, the Centers for Disease Control and Prevention guidance. And that uses the age of 2 for wearing a mask. So anybody under the age of 2 is not recommended to wear a mask. Any questions there?
No questions.
Okay, all right. I was doing some research and just trying to make sure I came prepared in the event I was asked to speak on Thursday, and I understand the reasons for that being the case and unable to being able to speak. But there are a number of studies, of course, that indicate that the use of masks does offer a level of protection for the people around you. And I do want that to still be a strong consideration as we move forward. The Public Health Department will continue to follow the science and will continue to recommend the use of face masks while in public and unable to social distance. Any questions?
Madam Chairman.
Yes, Supervisor, go ahead.
Denise, have you seen the Dutch study that devalued the use of wearing masks?
I have not. Would you mind sending that to me, Supervisor Johnson or Supervisor Gould?
Sure.
Thank you. The studies that I looked at were from the Lancet. And hang just one second. I have it here. This side. The Lancet, which is a weekly peer-reviewed general medical journal, published research on the risk of over 200 studies, the review of over 200 studies that showed that wearing masks produces a large reduction in risk of infection. The Proceedings of the National Academy of Sciences indicates that when used in conjunction with widespread testing, contact tracing, quarantining of anyone that may be infected, hand washing and physical distancing, face masks are a valuable tool to reduce community transmission. And then a study published in Health Affairs compared mask mandates and cases and provides evidence that U.S. states that mandated the use of face masks in public had a greater decline in daily COVID-19 growth rates and after issuing these mandates compared with states that did not issue mandates. So I think, Supervisor Gould, I mean, to your point, I recognize there's a variety of sciences out there and different perspectives. We're relying again on the Centers for Disease Control to be our focal point for our science, and also looking at the peer-reviewed journals and articles that offer us the best scientific evidence that demonstrates the use of face masks can actually help with preventing community transmission. Okay.
Madam Chair?
Supervisor Angus?
Well, Denise, I think you pretty much said it, that I can send you just as many well-respected journals and peer-reviewed journals and articles stating the opposite. And see, that's where our problem is now, because everybody now has an opinion about it.
Sure.
And they can back it up with the science. So we are at a point where, at this point, it looks like we are choosing the science that we choose to choose. And I think we all don't agree. And our businesses are looking at us and saying, like, what are you doing? So just to cut through it, I know we're using Title 36 as our guide, right?
Supervisor Angus, are you referring to our guide for enforcement, or are you referring to our guide overall as far as recommendation?
No, well, Title 36 would be enforcement.
Correct.
So I don't know for there or if it's another, you're going to go into that, but I would like you, because a lot of people are asking now, there's a lot of misunderstanding out there about what the county controls, what the health department controls, and what the state controls. So if you could just give a little bit of a short presentation about why we do the things we do, I think a lot of people would appreciate that. And if you can explain also Title 36 and how that works, I think people would appreciate that as well.
Okay. We derive our enforcement responsibilities and requirements through either title or administrative code. And in both cases, the state, and through a delegation agreement actually with the state of Arizona, with Arizona Department of Health Services. And I do have the county attorney, Knutson, is here to help as well as our EH manager, who can talk about enforcement and try to provide some overview there of our process related to the governor's executive orders and requirements thereof. But those are where we derive our authorities, and in those cases, we follow and have followed the county's approved process for complaint inspections. And our goal, of course, always is education, and using that education as a tool to ensure that people are aware of what those requirements actually are, and not being heavy-handed in any way. The second step, of course, is moving forward with an additional inspection, ensuring that there is compliance and that changes were made if they were out of compliance in the first inspection. And then, if not, we provide them with the inspection report, and then we would be back within a 24-hour timeline. The first spacing from the first to the second inspection is 48 hours. From the second to the third, it's 24 hours. So we're deriving our authorities from that to actually enforce the governor's executive orders, which is where our checklists are coming from. So did you want to know specifically about Title 36, Supervisor Angus, and how that fits in with this?
So Denise, I would like to know why we have to enforce the governor's executive orders. I mean, I know the answer to that, but I'd like for that to be explained again during this presentation.
Sure.
So we have Lenora Knudsen at the podium. She is an attorney for Mojave County.
Good afternoon, board members. There's been a lot of discussion on the executive orders, masks, and the enforcement process undertaken by Mojave County's Department of Public Health. There is an executive order, it's 2020-47, that remains in full force and effect. And I'll read just paragraph 8, which is the relevant portion for today's discussion. It says, in addition to the penalties and enforcement provided by IRS 26-316 and 26-317, failure to comply with this order and this is an important and any other guidance issued by the Arizona Department of Health Services related to the precautions to mitigate the spread of COVID-19 shall constitute a public nuisance. I'd like to just pause right there because I think it answers one of the earlier questions, and that is the only guidance that the Public Health Department in Mojave County is able to abide by at this point in time is the Arizona Department of Health Services guidance, which directly derives from the Center for Disease Control. So although there are many contrary opinions out there, we are required to enforce the executive order and any other guidance issued by the Arizona Department of Health Services related to precautions to mitigate the spread of COVID-19, and that any failure to comply shall constitute a public nuisance dangerous to public health pursuant to ARS 36-601. There is the link with Title 36. And when we enter Title 36, which is all about protecting the health of the public in the state of Arizona, and there are multiple chapters to that, then it becomes one of notice, education, and enforcement. And this executive order goes on. And action is authorized and shall be taken. That language is also very important because it takes away the discretion that we have to say, we don't really want to enforce this, or in Mojave County, we don't feel strongly about enforcing it, or any variation in between. The executive order says, shall be taken. That means the Public Health Department has to take action to abate the nuisance by the county health inspectors pursuant to ARS 36-183.06 and other law enforcement or state agencies as mandated by the Department of Health Services, including the immediate closure of such facility pursuant to ARS 26-303. I have been working closely with the Public Health Department and Director Burley to make sure, and they have gone to Herculean efforts, working 7 days a week, to make sure that their approach is to respond to a complaint. And that isn't our system, that is the state system. The complaints come from many different levels. It is not discretionary for us to turn a blind eye, at least in large part because of paragraph 8 here. But what we do have within our control is to go out there on that first inspection and approach it as education. We are providing the business owner with immediate feedback in the form of a report that lets them know exactly where they may have been in violation or exactly all the things that they complied with. Those checklists are provided to the business owner before the inspector leaves the site out of fairness to them. so that everybody has the same information. If there is a violation found, then that is the graduated system that Denise, Public Health Director Burley, was just talking about in terms of that warrants a second visit then. And that second visit is the 48-hour visit. So we're giving people opportunities to comply. It also means that health inspectors are working Saturdays and Sundays and holidays in order to be able to maintain those timelines. At the end of the day, I'm proud to say that sitting outside my office, I have approximately 70 files that have resulted in inspections, and not one of them has resulted in Mojave County closing the business down. We have educated and educated and educated and given opportunities to come back and follow up with people and say, yeah, you've corrected it, thank you for doing that. And every letter we send is about the collaboration between a business owner and the public health department to be able to say, we've got to work on this together. It is not, I repeat, it's not our goal to close businesses, but we have to comply with the executive order. That authority has been essentially placed, not so gently, in the lap of the public health department by the executive order. And so we're doing it, but we're doing it with an education focus. We're doing it with lots of self-correction steps built in and a direct path to compliance. We have not closed any businesses in Mojave County, 0. There may be businesses that have chosen to close, but not because of our actions. So public health is required to undertake these steps. Public health is required to abide by the guidance of the Arizona Department of Health Services, which draws from the CDC. Public health is required to remediate what's considered a public nuisance that's dangerous to public health in the state of Arizona. They've done it fairly, they've done it diligently. Every single business owner gets the same treatment and goes through the same steps. We have built the system to be able to go to the next step. And if we need to, shut down a business. But we've not had to use that. And it's my belief that that's the direct result of the diligent efforts of the public health department. So if I could answer any questions, I'd be happy to do that. I hope I answered the original question.
So I have a question. Are we required to accept anonymous complaints on a business?
Yes.
Yes, the short answer is yes.
And that is why? Is it in the executive order? Is it in ADHS guidelines?
Go ahead, Denise.
Supervisor Bishop, I haven't seen that language in the executive order, so I'd need to read through there to make sure that I understand that. But to my knowledge, it's not in the executive order, but we are part of the process as it relates to ADHS submitting complaints to us through their web portal. And so as an extension of that, we're receiving complaints and have, even before we were taking any kind of enforcement action, we were receiving complaints from the public before that and going out and providing education and taking on that role.
Okay, I would like you to check into that a little more thoroughly and closely, because I have to agree with Supervisor Angus, who brought up the fact that sometimes competitive businesses are turning each other in. And most recently, over the weekend, I've been notified of a business that was turned in anonymously by a caller, and it appears to be politically motivated, being this close to the general election. And so I kind of have taken a more personal interest in that particular case. And I think going forward, if we can do it legally, we should not take anonymous complaints, because I think if it's a real complaint, the person ought to be man enough or woman enough to give their name so that we know where that complaint's coming from. Thank you.
We'll certainly check on that, Supervisor Bishop.
Thank you. Any other questions?
Madam Chairman.
Supervisor Gold? Or Johnson?
Lenore, does the authority to regulate gyms and health spas flow from that same Title 36? Or is it because the majority of the board accepted that authority along with the $25,000 payment to enforce that on gyms and health spas?
There is a separate executive order, Supervisor Gold, regarding gyms and health spas, and the original one was 2020-47, and then it has been updated by, I want to say 2020-52. And the authority for the inspection of gyms, theaters, water parks, kind of all lumped together, comes from the originally, again, 2020-43 as updated by 2020-52. And it does treat it as a public health risk again, which then loops in the health services department. And interesting, this is kind of an aside, but the public health department had never had any inspection authority for gyms in the past, and so it has been introduced into the public health department solely for the purpose of the COVID inspections. That being said, the Arizona Department of Health did provide some checklists to assist with that process, but it was never before the responsibility of the public health department. But it is being treated as a public health risk, which then brings it under the authority of the public health department to inspect.
But didn't the board have to vote to accept that authority?
No, the board had to vote to accept the intergovernmental agreement that had some funds tied to it for the purpose of education. But the executive order is clear that the enforcement had to take place aside from and in addition to that intergovernmental agreement.
Interesting. These businesses were not regulated, and now by the executive authority of the governor, we're regulating unregulated businesses.
That is
Thank you.
true. For the purpose of COVID-19, you're exactly right.
Madam Chair?
Supervisor Angus?
Lenore, thank you for that explanation. Just hypothetically, if we voted or we just decided or however we did it not to comply with the governor's executive order, what would be the ramifications?
I believe we're in uncharted territory there. I don't know that any of us know what the ramifications may be. It certainly remains to be tested, unless Ryan has some additional information.
Well, I understand that other counties are not enforcing under Title 36. That actually we're the only county who believes we can do this under Title 36. Am I off based on that?
That would not be consistent with my understanding. In fact, we looked at some guidance from other counties and some forms from other counties, and the civil attorneys all are participating in a civil attorney listserv on a statewide basis, and there's a lot of chatter over the last 6 months about enforcing COVID-19, and it is my firm belief that there are many other counties that are enforcing it, maybe not exactly the same way that we are, because Mojave County has taken on a primarily education focus.
Right. And so at what point would a business have a monetary fine or be forced? How many visits do they get before they are closed?
Well, we have not yet closed anyone, so it would require actually a court action before we would close them. Mojave County would not make that ultimate decision. We would be filing an action in Superior Court to essentially enjoin them from conducting further business until they come into compliance. The sequence of it would be the complaint comes in, first inspection goes out. If there's non-compliance noted, the business owner is made immediately aware of that. There's a 48-hour follow-up inspection. If there's non-compliance noted, again, the business owner is immediately made aware of that. and then we're at the point of the third inspection at 24 hours. At the end of that inspection, the business owner is made immediately aware of the outcome of that inspection by getting a copy of the report before the inspector leaves the premises. And only after that point would we then issue what's called a 24-hour order to comply pursuant to 36-602. And that essentially would start the progression of civil penalties that are provided for in Title 36. And that would also result in, if we had to go to a 24-hour compliance order and they failed to comply, then we would be filing something in court the next day or the next business day to enjoin the business from operating. And by that time, we would have given them 4 inspections and 4 opportunities to come into compliance, plus a plethora of educational material, plus, essentially the pledge in every letter that if you have trouble complying with these requirements, let us know, we'll help you. We're not into shutting businesses down. That's not our purpose. But ultimately...
Right. At what point, because out of the blue, because I hadn't heard this before either, people are talking about like $1,000 fine a day or something. Is that part of the process?
Yes. After a 24-hour order to comply is issued, it is possible and was part of the step-by-step framework that we brought to the board. I don't remember exactly the date. Somebody up there may be remembering better than me with respect to the date of that. But it was, I believe the copy that we gave to the board was blue, and it was as listed as a flow chart. And in that flow chart, it talked about at stage 3, and I'm looking at one now, the 24-hour order to comply per 36-602 for continued violations. And on that flow chart, it indicates it is the authority of the county for $1,000 a day civil penalty at that point. And this flow chart was brought before the board and essentially approved by the board as the enforcement mechanism in Mojave County. It is $1,000 a day for a maximum of $10,000. It cannot go over $10,000 even if there's a period of time between issuing that 24-hour compliance order and coming into court. So it is capped at $10,000. We've never used that. We have not imposed a penalty on any businesses there have been essentially, at least as far as I'm aware, one exception to a business coming into compliance. And so we've not used it yet.
Okay, just one more, basically, I think, statement is that, I think you explained everything very well, but the only unknown and uncharted waters is what would happen if the county just said we are not enforcing the governor's executive order. So that might be something we could talk to our delegation about. I would just like the clarity of it because it's not law. It's an executive order, and I know there are laws that govern that. So just for the public who are asking questions and businesses, I'm very glad that you did this, and I think you cleared up some misunderstandings out there.
Yeah, and Supervisor Angus, I just might close by saying that although the executive order, the contents of it, is not law, the authority to issue the executive order derives from statute, and it's squarely placed with the executive in the state of Arizona. So this is not something that we as a county attorney's office can take lightly or turn a blind eye to. I think it would require some additional consideration and certainly some discussion at may be a higher level with respect to the what-ifs if the county chooses not to enforce.
Thank you very much.
Madam Chair.
Supervisor, go ahead.
Thank you, Madam Chair. This is for Director Burley. I'm not sure if she has the answer or Director Cunningham would, but I'm aware that a few of our executive staff are under quarantine. How is the county doing with employee exposure?
Supervisor Johnson, I would need to request that information from Director Cunningham from HR.
Okay. Another thing that I would like to address is on Friday, you told us regarding the state and how they've changed their cutoff time to noon now instead of 5 p.m. I feel we need to stay in sync with the state, or else we will just confuse the people. So I'd like to make a motion, unless the director has a problem with it, that starting tomorrow and until further notice, we change the cutoff time for our case reporting to noon and move to afternoon press releases.
Okay, we have a motion on the floor. Director Burley, do you have any comments on that before we?
I do not, no.
Are you okay with that?
I believe we would be fine with that change, yes.
Okay, we have a motion on the floor. Is there any further discussion? Okay, do we have a second?
Second.
Okay, we'll have a motion and a second. All those in favor say aye.
Aye.
Any opposed?
Aye.
Any opposed?
No.
Madam Clerk, did you get the vote?
Madam Chair, was there a no vote out there? Or is it delayed?
I couldn't tell. Supervisor Gold, were you a no vote on this?
No, I voted aye.
Okay,
Okay, then we should be good.
good. Okay, motion passes unanimously.
Madam Chair?
Yes, go ahead.
I believe we need to discuss the confusion we are having with people who can't understand why the board is not following our own board action on wearing a mask in the county building. The county has stopped people from entering our buildings without masks and advised them of possible trespass charges. And people are talking about a double standard. Now, I've been on the losing side of votes taken by this board, and I abide by the majority decision. If I feel strongly enough, I have the option of taking the decision to the courts, which I have done in the past. We watch our cities burn as leaders fail to enforce the law. I believe this board needs to honor our democracy. If we expect the public to follow our board actions, we need to follow them as well.
Okay, thank you, Supervisor Johnson. I think there is a lot of confusion out there because when our constituents see us setting up here at the DIOS, and like right now, I've taken the mask off in order to speak. Some consider that a violation and hypocrisy. But then again, on my right and on my left, we have Supervisor Gold and Supervisor Angus that typically don't wear a mask because that's their personal belief. So there is confusion. I've had constituents take photographs off from my Facebook page showing me outside enjoying the open, fresh air, and they think that is a violation. So I agree with Supervisor Johnson. There's a lot of confusion, and I think board decisions are just that, board decisions, whether you're on the winning side or the losing side. Once a vote is taken, it is a board decision, although individual supervisors certainly have their individual beliefs, but there's a difference there, and I think that needs to be maybe clarified again. Is that what you were referring to, Supervisor Johnson?
Supervisor Johnson?
Has left the conference.
Wow, that's convenient. But I believe that's what
Madam Chair,
Supervisor Angus, go ahead.
we can end that discussion right now by making a motion on what the sheriff recommended, which is just in the Board of Supervisor auditorium where people can come and watch their public meetings where their elected officials are. I'm not talking about the whole building. That's off the table now. We're just talking about the auditorium. You know, if somebody would make, because I've made the motion already, if somebody wants to make that motion, that would go a long way to showing people that, you know, we still want them to come and talk to us about their views and kind of clear up this situation that Supervisor Johnson is threatening.
Supervisor Johnson, are you back on the line?
Supervisor Johnson.
Has joined the conference.
Okay, Supervisor Johnson, were you able to hear what Supervisor Angus just said?
I believe so. Isn't that the motion that was voted down before?
I believe that's correct, although it was a little confusing the way that was put forward.
I didn't say I was going to make the motion. I said if somebody else wanted to make the motion.
I hear no motion, Supervisor Angus.
Excuse me?
There is no motion on the floor. So I believe the discussion is, according to what Supervisor Johnson brought forward, was the board majority votes and how that goes forward. Supervisor Johnson, did you want to continue with that conversation?
I was just trying to open it up for the conversation. I believe that, you know, we have a lot of things that we do by motion, and it's always been in the past that we go with majority rule, and now it seems to be that we're not doing that, and it's causing a lot of confusion. I don't know where we get the idea that, you know, we're going to now start, you know, ignoring what the majority of the board does. I mean, I think it's confusing for the people, especially when we're looking at, you know, possible arrest of people for not following the orders we put out.
Okay, Mr. Asplund, can you explain how the board operates by our standing orders?
Well, I think there's a difference of opinions on that I'm hearing back and forth, but generally, if the board has ruled on something, the board has made a motion and it's passed, I would hope and expect that those people would follow it. I think it's that simple. I can't force somebody to do something or not do something, but I think that, you know, if the board has voted one way, then you honor and respect that and you follow through with that. I'm not going to tell somebody what they should or should not do. Maybe I'll talk with them in privately, but if the board has issued and if the board has made a motion, then I would hope that out of respect that everybody would follow that, regardless of the issue, whatever the issue is. That if somebody says, you know, I was on the losing end of this, then I will respect that. And on the flip side, if you're on the winning end, that you'll respect that as well. That's what it comes down to.
Okay, any other comments?
Madam Chair?
Yes, go ahead.
I don't know, maybe the attorney can give us some direction on how we come to a resolution on this. I mean, because if we're not going to enforce the resolutions or orders that the board makes, we're kind of, you know, what's the point in having a board of supervisors?
Well, to answer your question, I think here's some possible resolutions. The motion that was passed was that all persons that come inside the building will wear a mask unless, and there was a couple of different exceptions that were on there that are not applicable here. So one resolution is that those who come into the building, they wear a mask. That's one resolution. We do that for public health and safety for the reasons that our public health director stated today. There are health reasons make it necessary to wear a mask. And so that's one resolution, is that those supervisors, all the supervisors here, all those that are participating, myself included, that we wear a mask. Another resolution is what Supervisor Angus proposed. Supervisor Angus proposed that one of those persons who was on the winning side of the motion, that they make a motion to reconsider, and to reconsider that vote to allow people inside this auditorium not to wear a mask. So that's another possible resolution that could happen there. Beyond that, I don't feel comfortable. I don't feel comfortable banning somebody like an elected official here because they're an elected official. They are representing the people, and so that's hard to do. But what I'm urging all parties involved here is to say, hey, a motion has been passed. I'm going to respect that, even though I disagree with it. So I'm going to wear a mask. Or you say, you know what? I don't think we need to do a mask here. I'll do a motion to reconsider, and we'll see if we can pass it that way. I think those are your two options right now. Those are the two that I wish that people would follow. I don't want to go down other routes. I'd rather not have law enforcement come in here. I don't take any pleasure in that. I think the presentation we heard earlier today about enforcement and education is exactly the same thing. We're educating, we're doing things, we're trying to comply. What I'm asking is that if the board has voted in favor of something, that everybody honor that, myself included, anybody else included, that we do that.
Madam Chairman,
Supervisor Watson.
I have a question for Ms. Burley. Supervisor Angus is asking for a motion to reconsider, and obviously she nor Supervisor Gould can do that. Well, what they're considering is allowing the audience to come into our auditorium without a mask. Is there a safe way to do that? Social distancing is depicted by every fourth seat, and skipping several rows. But how would people coming into our building, down the aisle, and in association with the other people in the audience, how would they be protected from someone that is positive if they were not wearing a mask?
The protection really isn't there, Supervisor Watson. And quite honestly, I don't know how that would be any different than people coming in, the general public coming in for services in and out of the front doors and engaging with security and other individuals in the lobby of the building. It's really about the protection for everyone, and the masks offer that protection.
And it's really for the protection of everyone, correct?
That's correct. Yes.
Thank you.
Denise,
Madam Chair,
maybe you know, maybe you don't know, our county manager, Elchers, might know. Did we get the count on the employees filling out the computer-generated poll in regards to their support for wearing masks or not?
Supervisor Bishop, I do not have that information. I believe HR was collecting that, and I'm unsure of the status of that.
Okay.
Madam Chairman, board members, those numbers were coming in strong. We had provided our employees until 5 p.m. today to respond, so we will provide that information as early as tomorrow. We had about 500 responses by afternoon on Friday, so I suspect it's higher than that. But we did give them until 5 p.m. today.
Okay, thank you, Sam.
Sure.
Supervisor Watson, one other point to make here is that there is a large percentage of people who are either asymptomatic or pre-symptomatic, and those are the individuals who are unaware that they are carrying the virus. And so the masks, having everybody wear a mask, those individuals are protecting those around them. And that's our goal, really, is to protect everyone involved. So, that's sort of the unseen and the unknown, but a very important point as we talk about protection and ensuring that people that are interacting and even in somewhat close proximity are protected from the virus.
Thank you.
Madam Chair,
Supervisor Angus?
but the same people will go to a restaurant and sit down amongst other people. I mean, if everybody was wearing masks and social distancing, But you cannot stop every little bad thing that might happen. All I am proposing, somebody make a motion, is they don't have to wear masks once they come into the Board of Supervisor auditorium. It is a public room for the purpose of people being able to address their elected officials. So they can wear a mask walking into the hall, into the entryway. But when they go in the Board of Supervisors and they're sitting 10 seats apart from each other, because we do social distancing, we're all far enough away from each other that they can take it off. They don't have to. They don't have to take it off. But if they want to, that's the only thing. And that is what the sheriff suggested, and it would solve a myriad of problems.
Supervisor Angus, I haven't shared this before, but I feel a little uncomfortable sitting in between you and Supervisor Gold not wearing a mask, and I don't have a choice. So that's why I wear a mask, is to protect myself, my husband, and the people that come to do county business in the auditorium.
Well, that's interesting because I've already had it, and I have the antibodies. But I'll tell you what I'll do to make you feel better and more safe. I will do what Supervisor Johnson has done for the last year and just not come to meetings. And I'll call in, and then everybody can feel healthy. Everyone can feel secure and healthy because I'm not there sitting there without a mask.
Madam Chairman.
Because I'm not going to wear a mask for 2, 3, 4 hours. I'm just not.
Supervisor Watson?
Thank you, Madam Chairman. One more question. Ms. Burley? Now I can speak a little clearer, I suppose. Supervisor Angus has proposed that people wear a mask until seated. Once seated, then they could remove the mask. How dangerous is that?
I always err on the side of caution. So I think you know that about me and what my recommendations have been to date and what I would continue to recommend. So I do understand that they are social distanced when they sit in these seats that are only marked for seating, and I think that is very important. If people would follow that guidance, and then whenever they left their seat, if they would put on their mask before movement, that is an alternative. But I'm always, as you know, going to be recommending the masks be worn the entire time.
Okay. Thank you very much. My next question is for Mr. Esplin. I believe at the outset of the pandemic that we outlined the use of masks in county buildings for not only the public but our employees. And I'm trying to recall the exact verbiage, but I believe that we were allowing our employees to take their mask off if they were social distancing in their office. Is that pretty close to the exact verbiage?
That's my understanding as well. It's pretty close to that. I don't know the exact language as well, but that my memory is the same as your memory.
Okay. Maybe between now and our next meeting, we can get that outlined and have a clear understanding. It's just I'm trying to recall something that's a few months old. But if we're asking the public to do something that we're not asking our employees or we're not doing ourselves, I want to make that clarification. So between now and Thursday, if we can accomplish that, I'd appreciate it.
Yes, I can pull that up and I work with the clerk of the board to make sure we have that so that we can present it at the next board meeting.
Thank you very much.
Certainly.
Any other questions?
Madam Chair?
Go ahead, Supervisor.
Thank you, Madam Chair. I have had no one approach me or call me with the fact that they've not been able to do business with the county, whether it be in planning and zoning, the clerk's office, the treasurer, the assessor, the recorder, the elections department. Nobody has been inconvenienced or refused service or been unable to deal with the county or any of its functions. The only problems or the only complaints that we seem to be getting are people who want to come in to complain about the mask, having to wear masks to come in. That was all, Madam Chair.
And Chairman Bishop, if I could just add something. I know that we're getting towards the end of the hour, but I just want to kind of emphasize just a couple of things about the legality of the mask and things like that. There's kind of two different areas or two different parts here. First, there's constitutional challenges to suggest under a First Amendment right that a person has a right not to wear a mask. And from what I've seen from the cases I've read and the legal analysis that I've seen, that is just not the case. There's no constitutional right to not have to wear a mask. That part is just, there's not as much of an argument there. And even if there was, the courts are very clear that for public health emergencies, the courts give a great amount of deference to the public health officials and the state health officials when it comes to public health emergencies, that they would say, hey, even if there was a constitutional right, this overrides this constitutional right because of the health and safety of the people involved. So that's one area that really doesn't, I just don't see much of an argument there that there's a constitutional right there, at least a First Amendment right. The second one is the one that often comes up is the Americans with Disability Act. The Americans with Disability Act is an act that has been passed by Congress, and there's three different parts to the Americans with Disability Act. There's a Title I, II, and III. What we're talking about is Title II. It's the public services. Governments, when they provide a public service, they have to provide it on an equal basis to all persons, regardless of a disability. So if somebody has a disability, the government entities have to provide those services on an equal basis. So what people will question is they'll say, well, I'm being denied access because I can't wear a mask or things like that. Well, there's a couple different layers to that. One is they have to have a disability that is recognized by the Americans with Disabilities Act. Many people, when they say, I'm not wearing a mask, it's not because they have a disability, it's because they don't want to. And that's not recognized as a disability. But there are some disabilities. There are some disabilities that would be recognized under the ADA that would say, hey, I can't wear a mask. And if that's the case, then what the government has to do is they have to provide reasonable accommodations. And we have those reasonable accommodations. We have provided those. If somebody comes in here and says, because I have a disability that is recognized by the Americans with Disabilities Act, I cannot wear this mask, then what we will do and what we have offered and what we'll always offer is, here's an alternative, here's the face shield. And we have those. They are free. We do not charge for anything. We will give them a face shield and will allow them an opportunity to participate equally with anybody else. So we have that reasonable accommodation. And if that doesn't work, if you say, you know what, I can't have the mask, I can't have this, then we have other opportunities. For example, I've offered to meet somebody outside and talk with them outside so that we're outside, we're not in a situation where we're inside. Or you can participate by sending in emails. We offer the accommodation at the last meeting for the call to the public. Instead of coming in directly, we gave it to the clerk of the board who then read them. That's an accommodation that we allowed so that people could participate in the process and do so with that accommodation. That's another accommodation that we've provided. We can do an accommodation by offering services by telephone. We can do accommodation by offering services by the internet so that people have an equal access to our services, whether it be here in this building or in the Public Works building or in the Development Services building, to do those things. So the mask, what you guys have passed, I believe is firmly, it is constitutional, it is legal, because we are providing reasonable access and reasonable accommodations so that everyone can still participate. Finally, so the last part of the Americans with Disability Act is that the government does not have to provide those reasonable accommodations. The government does not have to make those changes if there is a direct threat to the health and safety. And COVID-19, the pandemic, is a direct threat to our safety. And we want to make sure that employees and the public, anybody who participates in these buildings, are safe and protected. And that direct threat of what say, hey, we don't even have to provide these things, but we still do it because we want to make sure that everybody can participate. But it is a direct threat, and so technically we wouldn't even need to have to go down that road of accommodations because of the direct threat. So I just want to make sure that we're clear that we are offering services. People can come in, they can participate, they can do that, but they need to wear the mask for the health and safety of all persons involved. And if you can't wear a mask, we will provide the reasonable alternative of a face shield. And if that doesn't work, then we can do it by telephone, by email, other ways that we can try to accomplish that business, and you can get the business done with Mojave County.
Thank you, Ryan, very much. And can you or Lenore explain how the governor's executive orders can be changed or removed?
So the governor giveth and the governor taketh, right? The governor has issued those orders, and now in order to remove them or change them, it's got to come from the governor. The statute authorizes the governor to act in certain ways. That statute was passed by the Arizona legislature. The Arizona legislature gave him that authority to do that. And so if he wishes to change it, if he wishes to repeal it, that would be the governor itself. The other alternative would be a court order. If the court orders and says that the governor's actions are illegal, or the governor's actions are unconstitutional, or that the governor has exceeded his ability or exceeded his authority, then a court could order that. And we've been watching these cases because we want to make sure that we're on firm ground. And I can tell you there was early on a challenge to his authority to issue executive orders under this COVID-19 pandemic. And the district court for the District of Arizona determined that the governor had the legal authority to issue those orders. Then there was the challenge with the gyms, the fitness centers. They challenged it. And in that one, the Superior Court said it is within the governor's authority to do those things. But it wasn't unfettered. The governor cannot just completely do whatever he wishes to do. And that's when the Superior Court in Maricopa County said, but the governor has to give a pathway for these businesses to open up. And that's where we are with the minimum, moderate, or substantial spread and whether they have a pathway or not. So that's where the court has done that. So to make changes to that executive order, it's got to come either from the governor himself or from the courts. And I can tell you there's another challenge that's going on right now. It's the challenge with the bars. The bars are now challenging it and saying, hey, we don't have this. And so they're challenging that authority. And we'll see what the courts say there. And whatever the courts decide, we'll respect that and we'll follow that, whatever that is. But that one is currently pending as we speak. So.
Okay, and then as far as our state legislators, can they, once they get back into session, can they change the guidelines for what the governor is allowed to do with an executive emergency order?
I think so. I think that's what we've kind of talked about in the past, is that the challenge right now is that the legislature can't get back in session quick enough because one political party won't let the other political party get in. And I think Supervisor Gould was explaining that to us previously. But once that legislature gets back into session, then they could modify it. It's the Title 26, that emergency authority that the governor has. They could change that. They can modify that, and we'll see if the legislature wishes to do that.
Okay, thank you. And so to be absolutely clear for those watching on the video, Mojave County has not had, or have we ever even talked about, a mask mandate for the unincorporated areas of Mojave County. It's just never happened. We didn't do it. We don't have a mask mandate. The only thing that Mojave County has done is ask that we keep our employees safe by those coming into our county buildings to mask up while they're doing county business, and for employees to have certain restrictions. So I just wanted to make that clear. And for some reason, our constituents are really having a hard time believing that Mojave County is not the bad person in this scenario of masks or no masks. And I think to change what the governor's doing, that's going to have to come from either the court system or legislative changes. So,
Madam Chairman.
or the governor himself. Supervisor Gold.
For the legislature to change the governor's powers, the governor would have to sign the bill, which creates a problem if he doesn't want his power consolidated. They'd have to send it to the voters as a ballot initiative. Thank you.
Okay, and Supervisor Gold, since you're offering that information, how does that happen, a ballot initiative?
The legislature just runs the bill as a referendum. Then, rather than the governor acting as the executive, the bill goes to the ballot at the next general election, and thus the voters act as the executive. You could also do a citizens initiative to remove that authority from the governor by gathering of signatures and placing it on the ballot.
Okay, and certainly that would be more effective than social media or complaining that the county is too restrictive, is to go to that source and find out how to make things change at the state level. Is that correct?
I don't know if it's more effective or not.
Okay.
Madam Chair?
Supervisor Angus?
Supervisor Gould, how long are you talking about? You know, these things take, a citizen can take years. Whittling its way through the legislature can take a long time. If we're still in this situation by then, we have a lot more problems than just that. So that's all I'm going to say. What the things you're talking about are long time processes.
Madam Chairman.
Supervisor Gold?
Supervisor Angus, that would take 2 years. Thank you.
Supervisor Gold, you and Supervisor Angus are fading in and out. Am I right in hearing that you said that process would take 2 years?
Correct, Madam Chairman. At this point, it would take 2 years.
Okay, well, hopefully we are past this health crisis in 2 years, but at this point, who knows? Okay. Denise, do you have anything further?
I do not, no.
Okay. Does anyone else have any other business, any discussions? Okay, this meeting's adjourned.
Supervisor Johnson.
Has left the conference.
Ron Gould.
Has left the conference.